The value of home health from my perspective and from Gentiva's perspective, I think, is that what we do keeps people in their homes, safe in their homes, able to live in an environment that they are safe and they feel comfortable in. And it is less cost than the hospital setting, absolutely. And then it helps people once they have an exacerbation or an acute problem with their health disease and they go into the hospital, they come back out. What we do is we rehabilitate them or restore them back to their prior functioning, which means the level that they were, their activity of how they were before they got sick. And so instead of going into a nursing home or a skilled facility and having around-the-clock care or a hospital, the cost of home health, plus they're in their environment of where they're comfortable, and it's kind of the dignity and integrity of the patient also. It restores that. The majority of the population now that are requiring home health is a geriatric population, which is 65 years or older. And what happens with them is when they have a massive change in their lifestyle from a disease process, usually by a chronic disease, what happens is they sometimes also become very depressed because they have lost their not just their dignity, but their independence. It's loss of independence. And so from a quality of life standpoint, if I had a choice for my mother today to rehabilitate her back in her home and take care of her and teach her med management treatment, she would be much happier and progress much better than if I put her in a nursing home where it was an unfamiliar setting and she wasn't comfortable there. If we treat them at home and we get them on a maintenance program of preventative medicine and teach them how to maintain their diet, maintain their oxygen levels, maintain their medications, and knowing the warning signs of when to call the doctor and not wait for that ER visit, that's the benefit of home health. Because we can prevent them from getting worse and then actually even prevent their disease sometimes through education from them getting consistently worse as their disease or as some people's disease progresses. Home health care is building a system that will consistently build independence and medical management program in the home, much like outpatient clinics. And that's what I think we could benefit from, is that we continue to add education in the home and training and medical practices that will help build a stronger method for patients to stay in their home, stay healthier, and not have to go into the hospital. And long term, that should be better for all of us and from the patient's perspective and outcomes and the cost.